table this session with the Inside Utah Politics panel. RyLee Curtis is with Utah Health Policy Project. Evelyn Everton is with Americans for Prosperity Utah. Great to have both of you with us. Thanks for being here.
Thank you. Thank you.
Let's go ahead and start with full Medicaid expansion. That's an option that's on the table. Just to expand Medicaid the way the ACA called for. It's something your organization has been opposed to. Talk to us about what.
Sure. I mean, our biggest concerns, I think, are with the budget. Just like the House and the Speaker mentioned last session. There's just no way to know how many people are going to enroll. There's no way to really balance our budget. I mean, Utah has a balanced budget. We can't just print money if we need more. And so really that's been the biggest concern for us is how do we manage the state budget? How do we make sure that we have enough money and for roads and all of those things? So that's been our biggest concern with full expansion.
RyLee, how many states followed through and just went with full Medicaid expansion?
So right now there's 31 states in DC that have all expanded Medicaid. After they've done the expansion, none of them have backed out. Even in Kentucky, when the new governor was elected on that campaign to repeal Medicaid, once he got in there, he saw that it was worth keeping it for the state budget and for the people of Kentucky. And I think that Utah's governor wants to do it, and we would be in the same position if we could expand coverage.
Those 31 states in DC have gone through different alternatives, though, right? They didn't all just fully expand Medicaid?
Right, yeah. I mean, I think that the first influx of states were largely Democratic-led states that did a traditional full Medicaid expansion, and then we started getting these alternative proposals on the table, like Arkansas and Iowa had done, and that's what the Governor's Health Utah plan was.
Opponents of that are concerned about budgeting. That's one of the biggest issues, sustainability, the crowd-out factor. What do you see as a benefit of full Medicaid expansion?
Yeah, absolutely. So an ounce of prevention is worth a pound of cure, and we absolutely think that that's the same thing for Utah taxpayer dollars, right? So you put this money into prevention and treatment instead of, putting people in jail and paying for them in ER costs. That's why all of our premiums go up every year, is because we're paying for all this uncompensated care.
Evelyn, we've seen some alternatives to Medicaid expansion. The Governor's Health Utah plan, it's back on the table essentially with Representative Ward this year. Senator Shiwazawa is considering a bill that would scale that down a little bit to cover up to 100% of the federal poverty level. Are you guys opposed to those type of options as well?
Certainly, our Representative Ward's bill, we would still be opposed to. It doesn't address the budget problems. And I'd like to add, in the 17 of the 31 states that did expand Medicaid, they're all seeing budget overruns and huge enrollments that they just didn't anticipate. And so it's really put a strain on their budget and been very difficult for them to decide how they're going to pay. I mean, you have two options. You either cut services or you have to raise taxes. And I don't think that Utahns want either of those things to happen. And so and also we haven't talked about this yet, but, the federal government has a role to play in this, and certainly we want to say this is free federal dollars, but there's nothing free about the federal dollars. We're still paying taxes. That money doesn't exist. We're $19 trillion in debt to the federal government, and so there's just no guarantees that they're going to keep up their portion of the funding.
RyLee, what about these alternatives that we've seen here in the state of Utah through the governor and through Senator Shiwazawa?
I think that they're great compromises. They have very conservative principles in them. Instead of doing a traditional Medicaid plan expansion like Representative Dunnigan's would expand traditional Medicaid to these folks, these alternative plans are actually utilizing the private health insurance market. So they're giving people a greater network or access to these private health insurance plans, so Blue Cross Blue Shield, Select Health, whomever decides to offer. So it's more competitive. They can negotiate rates with hospitals. And they actually reimburse hospitals and providers at full commercial rates instead of Medicaid rates. So it's really a good deal for the people getting the plan, and it's a good deal for the hospitals too. And Evelyn, I wanted to point out, you're absolutely right. We're still paying these taxes, right? The state of Utah is paying between the tune of like $600 to $700 million a year in ACA taxes, and we're not getting the maximum amount of federal tax dollars back to our state. This is like turning down your tax return at the end of the year on principle, even though you're entitled to that tax refund back. The state is just saying no.
What about these issues of overcrowding that we're talking about, though? Going in and not knowing how many people will sign up? Because I know some states have struggled with that.
Yeah, I think that part of the problem was some of these states that initially did it, they did maybe one estimation of how many people they thought. They said, good, let's go. Utah has done 4 to 5 extensive studies. All of them came in at around the same estimates. So anywhere between 120 and 180,000 people would get coverage. in 2020. And I'll tell you, our state legislature is only required to look at 3 years ahead of time. We've looked all the way to the year 2020. We've done estimates for the last 3 years that we've been working on this issue, and we really have a good handle on how many people we think will enroll, whether they're above poverty, below poverty. And so, you know, I think that we've got a really good handle on that.
Are those estimates you think we should be able to trust and move forward with those?
Who knows, you know, but the point too, actually, I think that your audience should know is that of that 180,000 people that would now qualify for Medicaid, 75% of them actually already have their own insurance. They either have private or they can qualify for Obamacare. And so this would allow them to be able to kind of dump off those programs that they're paying for and get them onto Medicaid, which is a concern. I mean, should we be covering people who can, you know, afford their own insurance or get on their own programs? I think that that's a big concern as far as the cost goes and how Utahns want to cover that.
And that was the beauty of the Governor's Healthy Utah Plan, is that it utilized the private health insurance marketplace. And in fact, if someone had employer-sponsored insurance, it wouldn't make them lose their employer-sponsored insurance. The state of Utah would actually help pay some of that premium. So there's actually more incentives for people to drop their insurance and become poorer and sicker in plans that just expand traditional Medicaid than there are for these private market solutions.
Let's look ahead, because we've gone through these debates over the last couple of years. The Healthy Utah Plan has failed, full Medicaid expansion has failed, and we've come to this new proposal with Representative Dunnigan that does seem to be building consensus. Partial Medicaid expansion, taking out about 16,000 people. What are your thoughts on that?
Well, certainly our stance from the beginning has been if there are people that need to be covered, we already have a Medicaid program, let's reprioritize the budget to cover those people. So we would be in support of this or neutral on this, just because we know that there are people that need to be covered. We understand that there are some costs to the state if they're not covered, and so if this is a way to reprioritize that budget and figure out a way to cover that, then, you know, we'd be neutral on that.
Okay, RyLee?
So, you know, I think that we have to wait to fully digest what's in the bill. You know, it's just recently that it's been talked about, and so we're trying to figure out, you know, who is left out. So 16 of the 63,000 Utahns who need coverage, I think that that's a big gap still left. And so we have to figure out how do we move forward beyond this. And I think that state legislative leaders have always said this issue isn't going away. We've made that clear the last 3 years. And so it's just how do you continue to build upon that 16,000 if that in fact is what passes this year.
All right, ladies, thank you so much for being here. We appreciate your insight.
Thank you.
Don't go away. Inside Utah Politics will return in 90 seconds with a look at what's on the radar. Good.